Welcome to this special episode of Neuro Stories, created to accompany the TV series Trauma Room 1, which focuses on neurosurgery here at the Walton Centre. In these episodes, we go beyond the screen to bring you closer to the incredible staff and patients featured in the documentary, delivering outstanding services every day.
Hello, my name is Mohammad Altibi. I'm a consultant interventional neuroradiologist.
My name is Richard Pullicino. I'm also a consultant interventional neuroradiologist.
Both of you have been involved in some way or the other with the series that's on Channel 5 at the minute, Trauma Room 1. What was it like having a film crew in radiology?
It was such a nice experience, I think, from my perspective, to be able to showcase services that we provide for mechanical thrombectomy to Liverpool and the Northwest. It was very spontaneous, just turning up to work, doing my mechanical thrombectomy day cover. In a way, busy day. So when the camera crew came round and asked to join us for the day, I was like, okay, please welcome, And it was quite a nice experience for us to be able to, show what we do.
And for us, it's good in general, like Mo was saying, because we are a service specialty, similar to anesthesia. So sometimes we're not on the forefront. Patients don't usually see us. They tend to see surgery. They tend to see medics. We tend to be in dungeons, reporting. That's how people tend to see us. It's nice to see that our specialty is driving mechanical thrombectomy for stroke. It's one of the best treatments that we have in medicine. It has such a positive impact on patients. So yeah, I'm excited that this is being put on the limelight. Hopefully we'll get more in the future.
It was actually really good, you feel, to have them here to highlight what you're doing.
Yeah, definitely. I think it's good that the public, anyone, not just patients, but the public sees what happens. So also the concept in terms of stroke, that time is brain, and that there is something that we can do about. So I remember when I was a medical student, the only thing that you could do is give aspirin and sort of pray to a certain extent.
Gosh.
And I remember as a medical student, I remember asking a consultant neurologist, I told her, they're doing primary interventions in coronary, and the artery that supplies the heart gets blocked. Why can't we do similar thing to the brain? And then it was proven that this actually works.
Yeah.
It's good for the public to see what we do. Also, maybe we inspire other people who are thinking to joining our specialty or wanting to become doctors.
Obviously, Richard was alluding to what you do. So what do you do in radiology?
Between the seven of us, we share a 24/7 thrombectomy service covering a population of 3.5 million. And that also includes the Northwest and the Isle of Man. Our services essentially provide urgent treatment for acute stroke. So what is a stroke? A stroke is a condition where the brain suffers loss of blood supply. Most of the time would be resultant to a blood clot, which is inside one of the vessels in the brain. And depending on a lot of variabilities, a lot of patients would be eligible for this blood clot to be removed out. We would perform a procedure called mechanical thrombectomy, whereby we introduce plastic catheters within the body. And through that, we use techniques to be able to take that clot out. And the quicker we do this, quicker the patient would have their symptoms resolve. And I'm sure Dr. Pullicino have, similar to me, seen a lot of cases where patients improve dramatically immediately after the blood clot comes out.
You do see how ill people are when they come in, and that difference that you see when they have the clot removed, it can be quite striking.
Especially when it comes to young patients, when you see them recover so quickly, it's satisfying always to see a quick recovery. But when you see especially young patients recover there and then, it's very satisfying. Seeing that their loved ones are recovering and the patients see that they are recovering is also sort of a big motivator for us to continue working.
And also less of a stress on the system afterwards, because if there is such a reversal, that means less rehab, that means less staying in hospital, right?
Yeah,
Absolutely.
So this has been demonstrated also. There was a good research group in the London School of Economics where they've shown that even when you do let's say you do a mechanical thrombectomy for stroke and the patient still ends up disabled, they are likely to end up less disabled than if he hadn't had done the procedure. And because there's a lesser disability, the overall healthcare costs will diminish by around 25%. So there's a positive, just like Mo highlighted, we don't open the brain. No, we go through the natural arteries that we have in the body. Yeah. They're extremely expensive, but the benefit, the cost savings outweigh the initial cost related to the treatment as well.
So as interventional neuroradiologists, are you seeing more strokes, or is it that the system is gearing up to accept strokes quicker?
The short answer is yes. We're seeing a high influx of referrals that come through to our systems, and that could be attributed to a few reasons. First of all, there are emerging trials that include patients with a bigger age group, patients with a longer downtime, and also the fact that our thrombectomy service is getting a bigger referral numbers. And this is definitely a good thing for our patients. We're very grateful that we're able to spread our services to a larger population.
Being busier is always a challenge. What is that challenge like for you as INRs?
Our numbers have spiked quite a lot in the last year. The training numbers for consultant radiologists in that subspecialty is increasing.
Mohammad hit the nail on the head. I will quote sort of what one of my mentors, Dr. Kumar Das, who's a diagnostic neuroradiologist, works at. He tells me, Richard, in every service that you provide, make sure that what you're doing is a marathon, not a sprint. Okay, and that was a very valuable lesson for me. It's very easy to say, I'll continuously go out of my way. That is only short term. You need to think long term. How are we going to be able to provide the service safely, not just for our patient, but also for ourselves? Radiologists is well poised to provide this service. In terms of the training time, especially compared to other specialties, it's slightly shorter. So that's number one. The other thing is sort of because we're a service specialty, we are able to cater for that particular task and make sure that job plans and everything that is sort of geared to that. One of the problems that what we're seeing in general, this is nationwide, is that you have the big units which have a high number of INRs. But then at the peripheries, particularly at the east, it's not as covered. That is the challenge. How do we provide services to those areas? How do you entice people to start offering thrombectomy service in that region?
So you've both featured in some way on episodes. Have you watched yourselves on the programme?
It was very odd saying yourself, and you hear yourself differently, and I said, oh my God, I have more white hair than I thought.
And Mo, obviously you've done a couple of cases. What's that like, seeing yourself on the TV screen?
It's really weird, very strange. Not something that we're accustomed to, right? We're our job is completely remote from being on the front face on the television and stuff like that. But it filled me with pride to be able to represent the face of the Walton, represent my colleagues, and showcase, what we do. And I'm glad that a lot of our patients who we have performed procedures on, they've actually improved. It's completely, unstaged, very spontaneous. And this is exactly what we do on a daily basis. The reward also extends to my colleagues from the nursing staff, radiographers, allied healthcare professionals, because I don't think that we give them a lot of gratitude for what they do. I consider myself to be maybe, for example, in a football team, like the striker who maybe scores the goal, right? But it's a series of events that have led to get the patient as quick as possible in safest way possible. Radiographers optimize images, nurses would prepare the catheters, clean them up. So it's a team spirit, and I can't thank the team enough for what they do to us.
Yeah, and it's like literally in a pit stop, in a Formula One pit stop. Everyone is doing their thing in series, making sure that everyone does their job. And true, the pilot is sort of the star, but there's a lot of work that comes on. And also something which is important, we also have to appreciate our own mentors. It takes time to train interventionists to come. So, for example, in my case, I was very lucky. I had Dr. Mani Putteran, Dr. Chandan, and Dr. Hans Nasser, who obviously took the time to show me, let me do cases, and Mo, same, in Birmingham with Dr. Salamin as well. These things do not just, happen overnight. There are a lot of nurturing and also nurturing of other staff. So making sure that We have the nursing team in place, making sure that they are well versed in what our equipment is. Anesthesia, for example, having sort of similar protocols so that we can there isn't a lot of variation in terms of the anesthetic practices. So there's a lot of training. There's a lot of training and a lot of people at the background.
Thanks for listening to this special episode of Neuro Stories. All episodes of Trauma Room 1 are available to watch on My5. Just search Trauma Room 1 to catch up on the latest season now. For more episodes of the podcast, find us on Spotify, Apple Podcasts and YouTube, and stay up to date with the latest news and events from the hospital on our social media channels, at the Walton Centre on Facebook and Instagram, and at Walton Centre on X. If you've got any feedback, email the communications team at wcft.communications@nhs.net. This podcast was recorded, edited and hosted by Sam Fleet from the Walton Centre's communications team.